Well, happy Thursday to all of you, and thank you so much for tuning in. It's been an incredible, very busy week. Well, first off, let's get to the market because, as you remember, tomorrow is when we celebrate July 4th here in the stock market. So the market will be closed tomorrow. There will not be a financial market tomorrow, so therefore, there won't be a closing bell market update from me as well tomorrow. So enjoy the day off. Enjoy one day of not having to worry about your financial stance and your assets and all that good stuff. So Dow closed up today up 92 points and the NASDAQ joined up 53 points as well. A lot of positivity, I would say, in the markets today. Actually started off even more positive than that because, as you may know, today, actually the reporting of the June financial unemployment numbers came out blockbustering wonderfully, incredibly better than expectations. In fact, 4.8 million Americans went back to work, and that really beat expectation of 2.9 million Americans. So let's see if this continues. Now, do take into account, though, these numbers are from mid-June. Certainly doesn't take into effect the last 2 weeks of June, where we did receive more information about the pandemic and the coronavirus and all that stuff that we're going to be talking about. In fact, today I am so excited to welcome the one and only Dr. Jen. Dr. Jen is someone that I've actually watched on social media for quite some time. She is a powerhouse and someone that I'm sure many of you recognize. You've probably seen her on Dr. Oz, on the Today Show, on Steve Harvey recently, on so many, Rachel Ray. I mean, there's so many different television shows she's been a part of, and she really is someone that many of us trust. She's a family physician, TV health expert. So Dr. Jem, thank you so much for taking the time and sharing some of your time with us today. How are you?
Of course. And thank you so much for having me on. And by the way, I have been watching your broadcast and seeing your social media for years too. So the feeling is mutual. It's good to be here.
Well, you have helped so many. I know, first off, let's talk about credibility. I mean, you come from some of the best hospitals, best schools. We're talking Princeton, we're talking Johns Hopkins, we're talking numerous credentials. You're also a faculty instructor, professor, and someone that, I know Americans go to for financial advice and someone that they really trust as it pertains to their well-being of themselves and their family. So today I want to deep dive. Let's not beat around the bush, Dr. Jen. We're going to talk about the coronavirus. I think there's been a lot of misunderstanding and misinformation, and many times just information overload. So hopefully you can give us a little color on this. There's been a lot of debate, obviously, on the idea of whether things can go back to normal, right? We talked about just earlier that a lot of people now are going back to work and what that looks like. From your perspective, how do you feel about the situation that we're in currently?
Well, in terms of going back to work, is that what you mean? Like if
Mm-hmm.
and when we'll be able to go back?
Mm-hmm. How do you feel about that? More people are going back to work. Are there still concerns that you have from the medical
Oh, I see.
community? Mm-hmm.
Yeah, absolutely. I mean, well, not only are people going back, but we're seeing an increase in cases in certain parts of the country. I live in Philadelphia, and on the East Coast, New York, Philadelphia, Connecticut, New Jersey, we were sort of going through our situation a couple of months ago, and it was bad. It still is bad. I don't want to even imply that it's over because it's not. Now we're seeing hotspots in other parts of the country: Texas, Florida, Arizona, et cetera, California. And that is very, very concerning. I'm watching TV, I'm reading the reports, and it's reminding me of the things that we were talking about and saying about the eastern states a couple months ago. So, to answer your question, it's a mixed bag. I think that we did open too soon. Yes, there is the importance of people earning a livelihood. People have to work and be able to provide for their families. But, many states opened up perhaps too soon, perhaps too fast. And I think that's what we're seeing here. So what happens as we go forward, I think, is going to depend a lot on how well we can kind of quell the resurgence of cases in some places and the new cases that we're seeing in others. I think we just have to see.
Just like to see, and right, and you're seeing like states such as New York and New Jersey saying that, what, for the time being, if you're coming from one of the hot spots like we are here in California, we're going to let you pause for a bit. So there'll be the we may not let you into our city without that sort of time of sheltering in place, right? For like 14 days, they were saying. And so there's different parts of, the country that you said open too soon, but there's been a lot of controversy about masks versus not wearing masks. Even for
Yeah.
medical professionals like yourself, right? I saw even locally here, we've had videos from physicians who say, I agree. I don't think people should have to wear masks. I would love to get your take on that.
Yeah, well, I definitely don't agree with that statement. I do think we should be wearing masks. I do think that masks and the evidence has shown us that masks not only help protect us, actually more so protecting other people, right? Because when we started wearing masks, one of the things we were saying, and it's true, is that, someone else's mask protects us and our mask protects them, the spread of virus particles. We have to remember how we think COVID is spread. It's primarily through the spread of upper respiratory droplets. That's the droplets that fly out of our mouth and our nose when we talk and speak and when we're too close to other people. So masks help keep those particles to ourselves so that hopefully they don't go on to other people and potentially infect them. I do believe masks save lives, and there may be some evidence that they help us too. They help the wearer too. We need to be wearing masks. In fact, we probably should have been wearing them sooner than we started. Of course, there are a lot of caveats with what's been going on. We had PPE shortages. We still may in some places. Masks, et cetera. But the idea is, no, masks are important. And I know that there's a controversy, but in my opinion, it's not really a controversy. I think that if you're willing to follow the science and the advice of our leading experts, the only option is wearing a mask. And I also say, think about it this way, a lot of people gave up a lot during sort of the shutdown, the month and a half where really everything all over the place was kind of shut down, right? People gave up their jobs, they gave up their livelihoods, many were on unemployment. They gave up socializing with friends and family. They gave up a lot of things. Parents started homeschooling. And my thing is, after all of those sacrifices that Americans have made, why throw that away? Why throw that away and not honor all the stuff that we all did for a month and a half by going back in too soon, too fast without wearing a mask? In many ways, it's disrespectful to the work and the efforts that all Americans have put into it. Not to mention that in some places, cases are resurging and they're coming up, and masks are simply important.
Yeah, I agree with you so much. I mean, we've seen that here in California. We were shut down. We were one of the earliest states to shut down, and the numbers started to get better. And then things started to open back up, and you saw more and more people going out with the warmer weather to the beaches and to restaurants and to bars, and really not wearing masks. And that number has completely skyrocketed. We saw footage yesterday of a local hospital here in Southern California where it was a 4-hour wait to get tested for COVID. And the line,
oh my gosh.
Yeah, and it looked like, Dr. Jen, it looked like they were going to a U2 concert. Like literally the cars were going, like it was bananas. You would have been shocked.
Unbelievable.
It was shocking.
Yeah, it's a shame.
It's really a shame, and I'm glad that you're here to share this. And talk to me about how you're consulting your own patients now. Do they come into the office to see you? Are you doing more telehealth appointments? What does this look like for you and your practice?
Sure. I think that's a really great question. So, during the sort of shutdown, I think about that time period, maybe at the end of March, April, and then actually for us through May, I'm a family practitioner. I'm an associate professor at Rowan University School of Osteopathic Medicine. So I teach medical students and residents, but I see patients. We were only doing telemedicine or telehealth. I'd never done it before. I have to say, I wasn't quite sure how it would work as a method to provide care before all of this stuff happened. And I'm pleasantly surprised and really kind of educated about how telemedicine and sort of these electronic forms of communication can really help us out in this world. And I think the whole world has learned that. Winnie, I know you've been doing videos forever and using lots of platforms, but many people have not. So Zoom has come up and all sorts of things that I think have taught people that you can communicate without necessarily being face to face, but doing telemedicine, which I think was a really great thing. And we're still continuing that right now, but now we're starting to phase in seeing patients. So I do go into the office at least once a week and see patients. I am donned in full PPE. I have a gown on. I have a N95 face mask plus a surgical mask on top of that. And I have a face shield as well. So we are taking all precautions that we can, not just with us, but with our patients too. I was talking to my mother yesterday, and she said, "Oh, my doctor's office called me to come back in for an appointment." I said, "Oh, you're going to make the appointment?" She says, "Oh no, we're not ready to go back. We don't want to be sitting in a waiting room with all these patients." I said, Mom, a lot of doctors' offices are not having you sit in waiting rooms. We've actually started having patients wait in their cars to keep them safe rather than putting them in a room with other people. We only have 1 or 2 patients in the office at a time, and they're separated by space. They use private doors to go in and out of the office. We've completely refigured and reconfigured our workspace to keep people safe and allow for social distancing. So that is something I want people to know out there, is that, just because your doctor calls you back and you may be afraid to go, first call them and find out what things they're doing to help keep you safe, because I can pretty much bet they're likely doing a number of things.
That's really great, Dr. J. I'm so glad you mentioned that. I think, because I've spoken to a lot of parents like myself with children. A lot of them are afraid to take their kids to see for annual checkups, right? To go to the dentist and whatnot. And you're right. Like, even my hair stylist, he even sent an email saying, if you want an appointment, you're going to do these things, like these rules, and you're going to sit in your car, and then we're going to call you when it's your time to come in. So I guess what you're saying is this is a formula. This is sort of the way that we can get through this process, is just being mindful. And I guess our car is our new waiting room. So
yes,
when people are talking about, one thing that there's been a lot of talk of is if what it's going to look like when the summer rolls around. So we're in summer right now. A lot of people are getting cabin fever, right? We're ready to go out. We want to get out. We want to see. We want to feel normal again. And so the whole discussion of travel, Dr. Chen, where are you on the discussion of travel? Are you comfortable getting on a plane? I know you do a lot of media appearances just like I do. I have my own show. We film in New York City. And as of right now, from what I understand, New York has said, those of us from California can't come right now, but that's okay. What is your feeling about travel? Is it safe to do so? Would you feel comfortable traveling? What does that look like to you?
That's a really great question. So I need to sort of admit and be honest about where I've been throughout all of this. In my heart of hearts, I have always been concerned that we were opening up too soon, certain parts of the country, especially around Memorial Day when we saw beaches opening up, crowded beaches and things like that. It really kind of scared me. And, I'm on TV at least every day. I do a health video series on my Facebook page at Dr. Jen Caudle, and on Instagram and other platforms as well. And what I started to see happen was, despite how I felt, there were certain places that were opening up. And naturally that conversation shifted to, okay, what does opening up look like? And, look, I don't regret any of this, but I did segments, and still would, about how to fly safely, how to, let's see, other segments. So I talked about, like road tripping, using public restrooms. Is there a way to do that safely? How to fly safely? If you're going to dine out, how to dine out safely? And then what happened? And all that stuff and all that information is still just as true to me now as it was then. But what's changed, though, is that in that short period of time, those 2 or 3 weeks, where things really started to open up after Memorial Day, and now there's been this complete sort of influx of cases in many states, including your own. We talked about California, Texas, Florida, so many other places. And I'll be honest with you, when I was doing the segments, I told my fans I wouldn't fly. I've always been honest about that. I'm not ready to fly, but there are some people who have to fly for their work. So how can they do it safely? There are some people that, maybe, restaurants haven't opened up, but there may be people who work in restaurants still. What are things that they can do? But I still feel the same from a personal level. I wouldn't have flown then, and I said as much. I'm not comfortable flying now. In fact, my family, we just canceled a family vacation that we had scheduled for South Carolina in a couple of months. And we did that because of what's actually happening in the climate. I actually thought a few weeks ago that in a couple of months, I would be fine, right? I was like, oh, we're going to go. And now I'm saying no. So I know that's sort of a winding story. My point being is that things with coronavirus we have found are changing daily. And I have learned that with this virus too, we haven't really been able to predict things. And we know that opening up a little can cause sort of a big influx because of how infectious, contagious this virus is, et cetera, et cetera. So personally, no, I'm not ready to open up. I haven't started doing outdoor dining yet. I do, of course, go out for my walks and stuff like that. I would not be comfortable going to gyms, et cetera. In Philadelphia, we don't have that option. But there are some places that do. I'm really sort of keeping it close to the belt, and I'm staying home as much as possible. It just still concerns me, but everybody should take every situation risk by risk, situation by situation, state and location by location.
I love that. I think that's great feedback, and it's always important to hear from medical professionals like yourself, because at the end of the day, we need to trust our professionals, our experts. Because obviously, if it came to financial, I would know the answer to this, but for when it comes to my health, I definitely want to hear from you, Dr. Jen, about really those next steps. I remember, in fact, we saw Naomi Campbell's video months ago, her travel video.
Yes.
You know, I'm a big travel fiend. My family, we love to travel. That's like our biggest pastime. And we watched this video, and I was like, I love this video. This is so cool. You know, it's making wearing, like, I wasn't wearing face mask that much yet, but I was certainly sanitizing everything with my baby wipe. I mean, my
Yes.
antibacterial wipes. I'm like, see, this makes it cool, because if Naomi Campbell can do it, I can do it.
That's
But
right.
she did this, months ago, months before all this happened. And in fact, I bought my masks in like November, December, way before the pandemic even hit,
Oh,
only because,
wow.
yeah, because I travel so much for
Wow.
work, and it was like
Wow.
seriously flu season, cold season. And I was taking my husband and kids, we were going to Hawaii. And I was like, you know what? I just don't want anyone to get sick. So I want to make sure we can enjoy the beach. And so we did it. The kids didn't really want to wear the mask. But that being said, we had them as we came into this pandemic. So, Dr. Jill, what I'd really like to hear from you, one thing is, and you're a family practitioner, a physician that many
That's right.
people trust, right? And
Yes.
right now, schools are about to open up. Fall's coming.
Yeah.
Fall is
Yeah.
coming, right? It's not even winter.
Hmm.
Fall is coming.
That's
August,
right.
September. I just talked to some of our interns today. One is supposed to be going to Carnegie Mellon in the fall, and
Oh,
she doesn't
wow.
know what that's going to look like, right?
Of
But
course.
let's
Of
talk
course.
about younger kids. I have a
Yeah.
6-year-old, an 8-year-old, and 11-year-old downstairs. So right now, the school districts are saying, you got the option of going full time back to school, a hybrid version,
Yeah.
and a distance learning formula, the three options. And they're saying, well, although we recommend that you wear masks, it's a recommendation. It's not a everybody needs to wear a mask scenario, right? Parents are really, there's a hot debate of, what do I
Hmm.
do as a parent? Do I send my
Right.
kids in and
Right.
hope they remember to keep their masks on their face? I know for a
Right.
fact, my two youngest, and I'm sure you know because you have a lot of patience, my two youngest are not going to be good about keeping their mask on for sure. And if it means eating a snack or going to recess, there's no hope in that. What are you telling your patients?
That's a great question. And by the way, you saw me lean down. It's because I actually need to plug in. Give me 2 seconds. So I
You
don't want to
do
be
whatever
rude
you
and
need
be
to do, my
leaning
friend.
down in the middle of the broadcast. People are like, what's going on with Dr. Jen? Okay. So I
We
just wanted
don't
to make
care. As
sure
long
that
as
we
we
are
keep you, we're good.
okay. All right. So all the viewers, thank you for accommodating me. Yeah, no, the school thing is like so hotly debated right now in terms of with parents. We my family, we do family calls every week, and we were literally just talking about this on our family call. And there are a lot of parents in my family, but a lot of parents throughout the country. Many parents are concerned about what is it going to look like, as you mentioned. Is it safe? What if COVID starts going through the schools? What's going to happen? Now, this is what I do know is that there are a lot of organizations, including the CDC and others, that have made recommendations about how we can get back to school in a safer way. There are things that can be implemented into schools, things such as kids not going to cafeterias or the gym for a gym, like large spaces, right? Not doing whole school auditorium sort of presentations and things like that. Perhaps having the teachers travel from classroom to classroom instead of having the kids travel. Um, Everything from staggered start and stop times to staggered bus schedules and shorter days and this and that, opposite days of the week. There's a lot of sort of really innovative and interesting and great suggestions about how schools can make their environment safer for kids. There has been controversy though, in the sense of people are wondering if it's enough, if it will work, if it's enforceable, sustainable. And I think there are a lot of things we just don't know. I also think though that it also depends on where you live, because it's almost like the flying thing, the sort of going out to restaurants thing. Look, if you're in a hotspot city and COVID cases are going through the roof, going back to school, you may feel very, very differently about your kids going back to school than in a place where, they're in a state that's really
Like
not
New
changed,
Jersey,
or their
probably
numbers
no
are
safer.
low.
Yeah.
Yeah, so I think there's a lot of questions, and maybe in some ways more questions than answers. And I do think school districts and schools and teachers and medical professionals are really working hard to come up with viable solutions, which is a good thing.
I love that. So now, we're going right into July 4th weekend here. And
Yes.
many of us are pretty excited and we're getting cabin fever. We want to go out, we want to do stuff, and we want to go out to eat for sure. One of my
Yeah.
good friends, Mark, he told me, he said he and his family went out to eat, and it felt good because it felt like normal again.
Yeah.
But they said, and then my other friend, Mike, Mevich, who, I appear on Fox Business with him, and he says, it just wasn't quite the same. It wasn't quite the same experience. So, how do you go out and dine and do so safely? Do you have any tips? I know we've seen your video,
Yeah.
but what are some
Yeah.
that you can give us right before we go on a July 4th weekend here?
Sure, sure. Well, so first thing I would say is that before you decide to eat out, think about who you are and the level of risk that you have. We know that older people are at higher risk than younger people. And we also know that people with underlying medical conditions, there are a number of them on the CDC website, may be at higher risk for COVID complications. So first of all, is think about, am I someone who is on the higher risk scale, or am I not? If I am a higher risk, should you be going out to eat? Is this the time to go out to eat? These are questions you need to think about for yourself. Also, think about your family. If you have high risk folks at home, is it the best thing for you to go out to eat? Meaning, if you potentially caught something and brought it home, what could that impact be? So you've got to think about that and think about the area that you're in first of all, first and foremost. However, if you decide to go out to eat, there are ways to do it more safely. First thing is, I always say, drive your car. I live in a walking city, so I would walk if I went. But as opposed to valeting your car, you drive in your city. Drive your car and park it yourself, as opposed to valeting it, because it's fewer people in your car touching your stuff. That's the first thing. I would also say, of course, wear your mask. You can't get away with not wearing masks. You got to wear the mask. Choose outdoor dining instead of indoor dining. In fact, a lot of places aren't even doing indoor dining, which is a good thing right now, because the virus, we think, may spread more easily and more likely in an indoor setting. So you want to be sitting outside. Now, obviously, the restaurant should be working to make sure tables are 6 feet apart and doing all this kind of stuff. But it really is recommended that you wear your mask at all times, except for when you're eating, or, except for when you're eating, really. So when you're sitting there and you're kind of chit-chatting and things like that, you should be wearing your mask. And the other thing is, when you get to the restaurant and before you leave, make sure you wash your hands. But the other thing, too, I would say is, don't linger too long. This is not the time to spend 2 hours at your favorite restaurant, because the longer that you're out in the elements, potentially the higher risk of transmission, or rather the higher risk you may be for catching something, but just because you're out and about. So keep your visit short and sweet. Stay outside. Those things will certainly help you if you decide to go out and eat.
So, Jen, you know what, Dr. Jen, I'm listening to this and I'm thinking the better solution is to order takeout and eat in your car, and like find a fun place where you can hang out for a couple hours with you and your family.
Yeah.
Because that does
Yeah.
sound like maybe a more enjoyable eating out experience than stressing.
Well, you know what? I just saw, sorry to interrupt you, but I actually just saw on the news today that I think it's Walmart or some other stores are doing drive-in movies in their parking lots.
I
They're
love
turning
that.
They're turning their parking lots into drive-in movie theaters. So yeah, just go ahead and pick up some takeout and drive-in movies. I'm telling you, if they haven't been popular in a while, this would be the time that they're popular. Check
That
out one of
would be
those, or bring it
so
home, watch a
fun.
movie, get delivery. But yeah, no, I'm with you on that. I'm just a little bit of a nervous Nelly. I'm keeping it close to the belt these days. I'm staying
Dr.
home.
Jen, you're a doctor, and you're a nervous Nelly. What does that make the
I
rest
am.
of us? We should basically
Well,
be listening to this. I love this. Well, let's share real quick some of the areas
sure.
you can follow and learn more about Dr. Jen and all her great content. This is great. I think this is definitely something we want to learn more from you, Dr. Jen, as you go through your nervous Nelly stages. We will be following you along. And really quick, I want to say a quick hello to the one and only I call him Dr. Plumling, Roger Wakefield, amazing, and Robin Stevens. Thank you so much. I see so many of you. Thank you so much for all of you for joining us today. But Dr. Jen, so where can we learn more about you? And of course, all your media appearances, all the content that you're creating to help us stay safer.
Thank you. Well, thank you so much for having me, by the way. This was awesome. And it's so nice to sort of virtually meet you, because I've been watching you for years too. So this is lovely. I do have a website. It's drjencaudle.com. But I do daily videos that are posted on YouTube and Facebook. I'm at Dr. Jen Caudle for both. It's DrJenCaudle. But of course, I'm on Instagram. I'm on the gram, and I'm also on Twitter, Dr. Jen Caudle. So follow me. Let me know that you saw me on this program so we can chat. And I always like to answer viewer questions. So I welcome those as well.
Well, this was really powerful. I think it's great because I love how you're sharing your expertise widely and freely and generously with all of us, because I do think there's a lot of misinformation. And I think it's really nice to hear from an expert. I think in this day and age, the great thing about the advantage of being able to do something like this, where we're able to come together, the medical professional, the financial professional, we can come together in a relaxed state, share our ideas. And not only that, this just gives me a lot of hope. I think, in the future, if you're looking and you're like, gosh, I wish I could work with a Dr. Jen. I wish I could work with Winnie. You don't actually have to be in our neighborhoods now. You could simply set up a meeting, right? We talked about doing this through web conferencing or whatnot. I think thanks to technology, we're able to work with so many people that we love to help more readily and more easily than we ever have been before. So this gives me hope. I do feel like telehealth can be very beneficial to those of us, right? And as well as the sort of that next generation, as well as our elders too. I think having accessibility to the top medical professionals like yourself is certainly maybe one of the silver linings of going through this very challenging time for all of us. So
let's hope so. Let's hope so.
Let's hope so, right? So Dr. We're thank you so much for doing this. I hope that you will come back again and share more information with us. It is such a delight to meet you and keep inspiring and helping more people. And most importantly, have an amazing 4th of July, my friend.
Thank you.
You are incredible human.
Oh, I feel the same way about you. You are equally as incredible, and happy 4th to you and your family as well.
Thank you, Dr. Jen. And yeah, please, if you could do us a favor, definitely give Dr. Jen a follow on all her different channels. You'll see her handle right below, and she's on, as you talked about, she's on Instagram, she's on Twitter, she's on everywhere, and she has a YouTube channel. So give that show a subscribe if you can, and turn on that golden bell, because lots of great information from her. And just want to say thank you to all of you for tuning in. It's such a wonderful experience and blessing to be able to share with all of you. We'll be back here again on Monday. So remember, tomorrow the stock market is closed, and therefore our show will not be coming live to you tomorrow, but that doesn't mean we're going to be gone that long. No worries at all. We'll be back bright again on Monday, and I will bring you that financial information. And don't forget, we're getting closer to learning more about that next stimulus package. So you'll want to join me so I can share all the tidbits and things that you'll want to know for you, your family, your business, and all that good stuff next week. All right. See you soon, and take care now.